Hi everyone, thanks for listening to all my presentations. Today I'll be talking about liver cirrhosis. Liver cirrhosis is a long-term damage to the liver caused by fibrosis leading to loss of function. Liver cirrhosis has 4 stages, and these will be stages 1, 2, 3, and 4. Stage 1 is all about inflammation, like viral hepatitis, autoimmune hepatitis, and so on. Then stage 2 will be about fibrosis. And stage 3 is about scarring, leading to the cirrhosis. And stage 4 is all about liver failure. The best treatment is liver transplant. Besides the stages of liver cirrhosis, there are classes of liver cirrhosis, but wait till my last words here. Okay? It could be macronodular, which means the nodules are less than 3 millimeters in diameter. Example would be found if the liver cirrhosis is secondary to alcohol or hemochromatosis and so on. It could be macronodular, meaning the nodules are greater than 3 millimeters in diameter. And this is found in hepatitis, particularly chronic hepatitis like hepatitis B and hepatitis C. It could be mixed, meaning we could have both the less than 3 millimeters in diameter nodules or greater than 3 millimeters in diameter nodules. However, don't bother your head. It is not so necessary to classify cirrhosis. So you can stick to the stages and bother less about the classes. Causes of liver cirrhosis. Alcohol. Alcohol. Again, I said alcohol. And someone will ask, why that? Why repeating alcohol now just like that? Yes. This is a preventable cause of liver cirrhosis. You can decide not to take alcohol, and when you know from this presentation also that alcohol could give you liver cirrhosis later in life, you can decide to opt out from today. You can check my channel for a full presentation on alcohol. Alcohol. Again, I repeat, alcohol. Now, could be hepatitis B, particularly chronic hepatitis B, could be chronic hepatitis C, hemochromatosis, non-alcoholic fatty liver disease, biliary cirrhosis, wheezing disease, alpha-1 antitrypsin deficiency, and celiac disease. You can check my channel for full presentation on hepatitis B. I have about 4 already published. Also on hepatitis C, about 2 presentations published on biliary system, and of course, wheezing disease. I have all those presentations published right here. Part of the causes could be right heart failure. When there is right heart failure, there will be backflow, including backflow to the portosystemic system. Hereditary hemorrhagic telangiectasia, Veno occlusive disease, Polycystic liver disease, primary sclerosing cholangitis, autoimmune hepatitis, and certain medications like Methotrexate, Amiodarone, Methyldopa, and so on. I will go over a more comprehensive list after. Brucellosis and Syphilis all could cause liver cirrhosis. What are the possible clinical features? The clinical features here will be non-specific. So we might be dealing with fatigue, weight loss, nausea and vomiting, anorexia, weakness, muscle cramps, and easy bruising. Still part of the clinical features may be impotency, infertility, irregular menses, decreased libido, sleep disturbances, male feminization with increased estrogen to estradiol, hematemesis or malignar stool. And we might be dealing with liver decompensation. In that case, we'll be battling with jaundice, pruritus, bleeding, particularly upper gastrointestinal tract, ascites, hepatorenal failure, Coca-Cola colored urine, lower limb edema, hepatic encephalopathy that will lead to sleep disturbance, confusion, coma, drop in blood pressure, and eventually death. What are the signs? The signs are those stuff that the nurses and the doctors will pick when you visit the clinic or the hospital. So what are the signs of liver cirrhosis? Hepato-splenomegaly. You can check my channel for full list of probable causes of hepatomegaly. When you check the hand, you can pick erythema or finger clubbing. Hypertrophic osteoarthropathy is possible, and also tearing nails. Dupuytren contracture. You can check my channel for that. I have a full presentation of Dupuytren contracture. Asterixis, esophageal varices, hematemesis, black or tarry stools, bruising, and bleeding. Still part of signs of liver cirrhosis or signs or stigmata of liver failure would be fetal hepaticus, jaundice, parotid swelling, spider angiomata or telangiectasia, hair loss, particularly in axillary regions and the chest, gynecomastia in males, Cruvella Bomegatin sign, that is abdominal bruit with umbilicus or periumbilical vein dissension, caput medusae, ascites, testicular atrophy, and degrees or full loss of consciousness. How do we make the diagnosis here? A thorough history. Like the main cause will be alcohol, right? Thorough history, thorough physical examination. Laboratory investigations, I will go into details in a bit, and we can have ultrasound, CT, MRI, elastography for liver stiffness, nuclear studies, and the gold standard will be liver biopsy. Now, the good guy or the good lady has come from the lab, the sample has been taken, and now what are we expecting? We'll go through AST, ALT, and AST to ALT ratio will be greater than 1. ALP will be increased 2 or 3 times the normal limit. GGT will also increase, particularly in the face of alcohol. Complete blood count will be necessary, and we want to know what the platelet is all about because we might be dealing with thrombocytopenia. We might be faced with pancytopenia because the liver function is impaired right now. There may be decreased albumin. Sodium level will suffer with decreased sodium. Still in the lab, we might be faced with increased PT or INR and also increased APTT. Remember, all clotting factors are produced in the liver except 2. The 2 will be factor 8 and von Willebrand factor. So, both the intrinsic and extrinsic pathways are affected. Increased bilirubin, for obvious reasons, increased creatinine, hepatorenal failure, Increase or decrease glucose. I will talk more about that the next slide. Now, increase or decrease glucose. In fact, there will be a separate presentation on hepatogenous diabetes later on. But for now, there will be glucose dysregulation in the face of liver cirrhosis. Why that? Either we are dealing with no response to insulin that will lead to elevated glucose, or glycogen storage is diminished and there is no glycogen lipolysis or gluconeogenesis from the glycogen, leading to a drop in glucose. Diabetes mellitus here is difficult to classify as type 2, and it is not even accepted as type 2, and may be subclinical if the liver cirrhosis is still compensated. Let me repeat. Diabetes mellitus that will ensue here is not type 2 diabetes. It's not accepted as such. And when the liver is not yet decompensating, then the diabetes mellitus problem here could be subclinical. So, the diabetes mellitus secondary to liver cirrhosis is having a separate nomenclature known as hepatogenous diabetes. Don't worry, check out here the next few weeks or a month plus, there'll be a separate presentation on hepatogenous diabetes. Then I will go over what this is all about, how we come about that, and how we can rescue the affected patient. Because it's difficult to treat. It's not type 1, it's not accepted fully as type 2, and if you give oral hypoglycemic agent, the liver is in trouble. How will you get the medication to be metabolized? You could see we need to watch out for that presentation. Still on laboratory investigations. Because this could be a result of autoimmune condition, right? Because autoimmune hepatitis is possible to be the cause of liver cirrhosis, and there is that fact or principle that when you pick one autoimmune condition, you better look out for the rest. It's likely going to be more than one. So, when we do thyroid function test, we'll likely have increased TSH from autoimmune thyroiditis. Rheumatoid factor, antinuclear antibody, anti-smooth muscle antibodies will all lead us to whether or not we are dealing with autoimmune condition here. Increased globulins, for example, increased IgG in autoimmune hepatitis is possible. And of course, increased IgM will occur in the face of primary biliary cirrhosis. Ceruloplasmin level will drop. And when we pick that, then we are dealing with something else called wheezing disease. Like I've said earlier, you can check my channel for full presentation on wheezing disease. In wheezing disease, there will be decreased ceruloplasmin. The affected individual will be on penicillamine for life. It can come down with dementia at a younger age. With that, I've come to the end of this very presentation. Remember to pass your comment. Remember to give thumbs up. Remember to share this very presentation and subscribe to my channel. I have more to publish on liver cirrhosis. Thanks for listening. I appreciate it.